Okay, mental illness in prisons. When did prisons become acceptable mental health facilities? Today I'm here to persuade you that mental illness in prisons is an issue within the criminal justice system. I recently did a case study on this topic and it opened my eyes to just how much of an issue this is. Also, working as a paralegal in the criminal justice system, and I'm assigned to the mental health cases, I come across so many cases with defendants who have a mental health illness. The reason why this is a problem is because prisons are generally focused on incarceration rather than the needs of anyone who has a mental health illness. Being incarcerated does nothing for the mentally ill. It actually worsens their condition. This also causes an issue because inmates are released back into prison without the resources they need to survive on their own. No medication, no therapy, no types of services to get them back on their feet. They land right back in the street and end up reoffending and go right back to prison. Recidivism rates for mentally ill inmates are also sky high. So today, what I'm going to do is illustrate the problem of mental illness in prisons and how it started. I will also talk about why it's an ongoing problem, and I will offer some possible solutions that I feel will help control it, as well as provide these inmates with some type of proper help they need before being released or before they're even arrested. So how did it get started? Trans-institutionalization entered mentally ill individuals into the criminal justice system, and they changed the face of prisons. Trans-institutionalization is defined as the moving of mental health clients from one institution, such as mental health hospital, to being dependent on another type of institution, such as a shelter, community hospital, jail, or nursing home facility. And I added this bar chart to show that it started in around 1969, 1970, and you can see that most of those offenders were in state hospitals. That's the orange. But as the years went on, they ended up becoming prisoners in prison. Over 30% of California prisoners currently receive treatment for a serious mental disorder. This is an increase of 150% since the year of 2000. The CDCR estimates that the population of prisoners with mental illness will continue to climb, increasing their need for additional psychiatric services in the years to come. Inmates with serious mental health disorders are sent into prison without any plan for treatment or medication. The result is that their condition worsens. The lack of knowledge and training. Correctional staff usually have limited knowledge of mental health issues and appropriate interventions. Mental health in segregation units are typically limited to psychotropic medication and occasional meetings with a private clinician. The lack of resources. Individual therapy, group therapy, structured educational, recreational, or life skill enhancing activities or other types of therapeutic interventions are usually not available because of insufficient resources and rules requiring prisoners to remain in their cells. I added this picture because it just shows how their treatment is with their clinicians. They're that little box right there is how they have to speak with their doctors. Solitary confinement. Solitary confinement has continued to be the method of choice for U.S. prisons, in U.S. prisons for inmates who show signs of mental illness. Solitary confinement is one of the most severe and cruel forms of punishment, especially for someone who's mentally ill. Inmates in prison are often victimized. Many are raped, hurt themselves, and even commit suicide. Recidivism rates are soaring, and there's no hopes of rehabilitation due to the long-lasting effects of incarceration while being mentally ill. Now I know what you're thinking. Why do they deserve special treatment? Why can't they just be held accountable for their actions just like the rest of the general population? Well, there's different effects for people who are mentally ill that get incarcerated. Persons with mental illness are impaired in their ability to handle the stresses of incarceration due to to conform to routines. They may exhibit bizarre, annoying, dangerous behavior and have higher rates of disciplinary infractions than other prisoners. Placing mentally ill inmates in solitary confinement has serious effects. More effects of the incarceration: the stress, the lack of social contact, unstructured days can also worsen the symptoms or illness and provoke reoccurrence. Many policies and procedures used by prisons in an attempt to keep those with psychiatric disorders safe, like restraints, seclusion, segregation, are very detrimental to the mentally ill inmates, physically and mental health. Treatment resources. It's clear that in most, though by no means all, jurisdictions in this country, mental health treatment, housing, and rehabilitation resources are insufficient to serve the very large numbers of mentally ill persons in the community. Mentally ill persons who have been to jail may not be able to gain access to community treatment, even when it's available. These persons have been described as resistant to treatment, they're dangerous, they have serious substance abuse problems, sociopathic characteristics that are generally not considered desirable by most community mental health agencies. So what are some of the solutions? My solutions are: police officers are generally the first people who have come into contact with those with mental illnesses. I feel that most officers don't understand or recognize the need for their serious help. There should be a formal training for police officers to help them to understand mental health illness. By giving officers this training, officers will be able to make the right decision in assisting those who are in need of help. Instead of sending them into criminal justice system, officers will be able to give them access to the mental health facilities. Another solution I came up with was, when an inmate is booked into the facility, they should have a full screening for mental health disorders on that individual. Increase budget so that inmates can come out of their cell for proper treatment. The facility should also have a psychiatric team on board to assist with evaluations, with treatment, and necessary medications. These teams should also be trained to recognize the need for serious help. If an inmate needs to be transferred to a psychiatric hospital, the psychiatric team at the facility should be able to make that call or referral. More solutions. We need to create more systems that support mentally ill inmates once they are released from prison. By providing them more support systems, they will have access to mental health services, and it will prevent their interactions with police. The support should also include drug and alcohol treatment, housing, education, employment, as well as peer support. If they do run into law enforcement, they should have the option to be diverted into treatment services before being arrested. The quote from Hillary Clinton is that our prisons are our jails, and our jails are now our mental health institutions. And in conclusion, mental illness is definitely an ongoing issue growing within prisons. The mentally ill have no other place to go other than falling back into the criminal justice system. The stress, the lack of social contact, the solitary confinement, and other constraints that come with being incarcerated only make the mental condition worse. Once they're released from prison, they have no access to health care. And without access to health care, a job, housing, many find themselves right back in jail or in prison. I hope I've persuaded you that mental illness in prison is an issue within the criminal justice system. As I mentioned earlier, my work as a paralegal handling mental health cases gives me a closer look into the problem. To ensure the best possible outcomes for individuals, which includes keeping them out of jails and prisons, it's essential that we create systems to support people as they transition both in and out of incarceration. Mentally ill inmates are typically jailed for small offenses such as trespassing, disorderly conduct, or drug use. They also tend to stay in jail longer than impaired inmates. They recidivate and return to jail more frequently which costs them more to incarcerate. The problem will continue unless we learn to distinguish between mental illness and criminality, as well as actually treat these inmates who are actually ill. This concludes my presentation.